Welcome back inside the Now Morning Show. Just about 42 minutes after 6 o'clock. If you're looking at outside and saying, I need to get out, yes, you need to get out. You can take us with you on the phone. We are streaming live on Facebook, and you can listen to us in the car, on the way down the road, on your Maxi, or wherever you're heading, however you're heading to wherever you need to go this morning. But I thank you for tuning in. Don't be late for work on account of us, and then blame me when you see me in the road, okay? All right.
You might
but
get
it's
a
the
phone call.
it's the Tobago Thursdays, and I'm so happy to have you here with us. Of course, we're standing by for a conversation, a very interesting conversation, because there's a new health card that's being presented in Tobago. TTU to Rise, they always try to be on the cusp of being there for the citizens, being there for the nation, and being able to assist where they can. And this morning, Ambassador Nkosi Phillips is going to join us to chat a little bit about that health card. But I understand there was something happening at the Art Society before we get across to that.
Before we get across to that, so the Art Society last night launched their members exhibition, and it was very moving. And there were many pieces, of course, that spoke to everybody. It's one of those situations where you just walk in and literally you feel the energy, the vibration in the room. And we'll hopefully get a look at some of the pieces in the next hour and tomorrow as well, because on Friday, guys, you have some members coming in from the Art Society.
Okay.
But there was a fantastic piece, and it was
No. Could you stop? The
What?
reason why I said really is because, remember last week you interviewed a few gentlemen.
Right.
Were they from that thing
They
as well?
were.
I know that, yeah, okay.
Harande, some of his pieces were
Harande,
there.
yes.
And there was one piece that was Tobago, essentially. It was called The Arrival. And it was so beautifully done. Hopefully in the next hour we can pull it up on the screen. It's fascinating to see the way that people's views, their energies, and their life just translate onto canvas and all the different modes that they use. So I just got a notification that we don't have it, but that's okay, because you should go down to the Art Society and check it out as well. It was great. There was live entertainment. Everybody was just talking, having a good vibe.
Yeah.
And there's so much talent in our country. It's ridiculous.
Yeah.
We need to pay respect to the arts.
Yeah.
Say it again now. I don't think they're just
We
hearing us
need
here.
to pay respect to the arts.
One more time for those in the back, no? I just check it. I just check it. I just check it to make sure now, boy. One more time for those in the back.
They
now,
heard,
boy.
they heard.
But also, guys, so I took a ride here yesterday evening, and I have to say hats off, because we've really seen that culture take off in Trinidad
Yeah,
and Tobago
I
as
agree.
well. And you feel so safe. You're able to just converse with your driver. And again, it's just that safety. But talking about safety, I know that that's also a big part of Ambassador's movement as well.
Well, yeah, so the TTU to Rise, they have partnered with Bismarck Technology and Learning Limited to supply health cards to Tobagonians. And of course, well, if you don't know about Bismarck, it's a company that engages in research and development and provides technology-based services and solutions. And so this morning, I want to welcome Ambassador Nkosi Phillips, who joins us on the phone. Good morning to you, Ambassador.
Good morning to Trinidad and Tobago. Good morning to you and to TTT and the listening public of Trinidad and Tobago. Good morning.
All right, so exciting news this morning. Tell us about this health card. How does it work, or what is it really all about?
Right. This health card was introduced in partnership way back then. I'm now in 2020. If you remember when you interviewed me, I talked about the health cards that I wanted to do for persons in Trinidad and Tobago, if elected and stuff, and for the special needs kids, for kids with diabetes and all this. So it actually came into effect with partnership with Bismarck, the CEO of Bismarck Technology, Ms. Carol Savangson. It's a pet project that we've been working on since then. And we were so happy that it came into Diabetes Month when the card came into effect. So the card now, it's as you see on the video, there's a card. It's on NFC technology, and with NFC technology, for example, if God forbid, if your child is injured in school or unresponsive, and that child goes to the hospital, the doctors don't know how to treat the child because they don't know what the child has, what the child medication is about, or anybody. They try to call the parents, nobody is there. What they can do, the EMT or the doctor could do, is take that card, because there are different types of it. There's the card, there's the bracelet, there's different stuff. They tap the card on the phone. Once the phone has NFC technology or QR code, they tap the card, and the person's medical history immediately comes up one time. They will say, okay, good. Charan Singh is allergic to penicillin, the next of kin, and what will happen if that person is an emergency, for example, an emergency GPS locator or tracker will come up on your phone stating that your child is in the hospital emergency. No matter if your phone is off, your phone will have a beeping alarm that will send a signal showing that your child needs you right now. The technology is also upgraded whereby there's a GPS tracking service in case the person is found or we have a senior citizen who walked away and cannot be found. Once that is located, once you press the alert button, you can find your senior or loved one or anything.
All right. So is the card ready and available?
The card is ready and available, but what happened, we just launched the first 20 batch in Tobago, and we had a conversation, we had a little brief meeting with the Secretary of Health, the Wednesday before the program, the launch of the card, and from that meeting, we had the launch of the card on the 20th with the distribution, where we distributed to some children with cerebral palsy and persons with diabetes, and the conversation started there with the Secretary of Health. We are passing it to the Secretary of Health in terms of persons around Tobago getting this technology. That is a conversation that is yet ongoing with the Secretary of Health and the Minister of Health, because she said she would have passed on the information there, and they're taking it from there. What happened? We just started the batch. We started the launch, so persons could be aware of it, and this is a pet project that we were doing to see how best we could alleviate some of the tensions we have in the healthcare system. So
now,
the partnership. Go ahead. Sorry.
Yeah, sorry, Ambassador. Sorry to cuss you, but one of the challenges that we do face in the healthcare system is that that transfer to digital and to online and to being able to access patients' health records digitally.
Right.
We still see in the hospitals where they go and get a file, they go and get a folder filled with all of your information if you've been there for however many years, etc., etc. How are you able to transfer that information onto the digital card if it's not digitized just yet?
Okay, so what will happen is that if the government or the THA comes on board with this, the company will issue specific phones to the healthcare sector. For example, if the government or the THA said they want 60,000, and they will be receiving phones that's in a package deal, they'll be receiving specific phones. For example, the EMT will have one on the ambulance, at the charge room where the accident emergency, the senior doctor and the nurses who are charged. So what will happen? When you are rushing to the hospital or you have an emergency, the nurse will just have to tap the card, the information comes up and it shows that this is a risk patient. It goes directly to the senior doctor on the phone, stating that this person has to be checked immediately. Then with the senior doctor,
Just help me understand, how is the information getting onto the card if we're still taking it down on pen and paper?
There's a URL. There are three ways to do it. You have the URL, you have a QR code, and you have a password. So now, what is happening is that you are going to get three ways to store the information. You're going to get your own URL code. You're going to have a QR code, or you could do it by an email, or you're going to have your own password. So for now, the technology is in your hand, and you are storing it with your password. So there's nobody getting the information. Once the government comes on board, then they'll create a website or a service whereby the information is stored only in the health sector. So for now, as it stands, the card information will be stored in your privacy and in your capacity, as it is. But there's three ways of getting information.
So I'll be the one putting the information onto the card that the doctors and the nurses and the EMTs can now access with the scan of a QR code or the tap or whatever the case is.
Yes, you will have that for now. And then with that, it can also be upgraded to future references. For example, again, if you go to a specialist or a private doctor and the doctor said, okay, I want to know what is the medication, what they think, what they can do is tap the card again on their phone and say, okay, well, your specialist says that you could only get this type of medication. So for now, as it stands, the information is stored in your hands and in your password. Nobody has access, not even us. We are only creating the thing. So the persons who would have collected the first batch, we still have more distributions to do with the Secretary of Health, and we are waiting her the list of names so we can do the rest of distribution. Then we're going to have a class to train the persons how they can upgrade and upload the information onto their phones, and then the card will be accessible by them. And then, like I said, if the government do accept this project and accept through the Secretary of Health, it will become a technology used in the healthcare system, and then therefore now the government itself will have that responsibility. They will have the partnership with the company and Ms. Karasavan Singh, and they will liaise as to how the technology will be more used and updated in the Trinidad and Tobago healthcare system space.
Right. But in the meantime, Ambassador, are we not concerned that people, I mean, we already know people who self-medicate and they already decide for themselves what's wrong or right with them and how they're going to treat with it without the assistance of doctors. With this health card, is there any way to, you said, I'm in control of putting in my information. So if I decide that I think it's a good idea for me to be on antibiotics, I could put that in there and go to the doctor and say, well, look, according to my health card, I could be on antibiotics.
No, what will happen, and I said, when we train the persons of what information they put, they are putting the information on the card based on what they think. What are we going to do? We're going to ask them to request their information. So therefore, we're going on with them one-on-one. They're going to put whatever is on there. We're going to train them. We're going to actually put them. So we're going to be there with them one-on-one. So now, as I said, this is a pet project now. In this capacity, this is first distribution, right? So for now, you're going to put all the little information that you have, what you're allergic to, all these things for now. And then when you want to advance, we're giving you the part where you could get your information access. I know that you could go to the hospital and ask them for a copy of your record. Then individually, we can put it on with you and make sure that it's accurate. But remember, you also have to be true to yourself. Because if you put that there and it's not what you do, you're putting yourself at risk. So when we're going through the cards with the patients and the persons who are interested that we distribute it to, we will inform them of all of that because you can't lie in the medical records. And then from there, as I said, this is just a pet project for now. Once the THA and the government comes on board with this initiative strongly, then it will be more controlled and more managed where then it will be going through the government system and the THA system where there will be more control under that realm. But for now, we just after giving them the card so they can see what it is, see how to use the technology. If the technology is worth it, which I know it is worth it, that is where we are right now in that part.
All right, fantastic. Well, I want to thank you so much for joining us this morning, Ambassador, and sharing this technology with us, or at least the beginnings of it, and I look forward to seeing how it evolves over time.
Yes, for sure. As I said, we'll have more to see and more to come, and this is just the beginning of what we have. We're launching it. We also want to distribute 20 to the health minister and his constituency. We're also looking at the 10 CTPS officers in Trinidad who have special needs kids and kids with cerebral palsy, etc. So as I said, we're putting the technology out there so persons could be aware of it, and then they could see the use of it. And I think by the minister getting the information, I think this will be something to enhance the future technology of Trinidad and Tobago's healthcare system. So
all right, let's see.
Thank you very much, and we look forward to more information from us.
All right, take care. Let's see if it takes hold and if the relevant parties get on board. Thank you so much, Ambassador Nkosi Phillips. Take care.
Not a problem. Thank you very much for having me, and thank you, Trinidad today.
All right. As the founder of TT Youths Will Rise, Ambassador Nkosi Phillips joining us to share about the new health card that's been distributed to a few students, and in hopes that people can get accustomed to using it and get accustomed to the idea and buy in to the idea. And by people, we namely mean ministries of health across the islands. So we take a quick break and come back with more inside in our morning show. Stay tuned.